Hi friends, once again welcome back to the Nurse channel. So you're watching the 10th series in our AIIMS NORCET series, and we are very happy to see the response from you all people, and we are very happy to see that you all are getting benefit out of these videos. So as per your request, in this video also we have included questions from nursing research, administration and education. So like our old videos, this set also contains 15 questions which are taken from different aspects of nursing subjects, and this includes repeatedly asked questions, then picture based questions and picture based explanations. So I request everyone who are watching this video to watch the video till the end without skipping, and kindly subscribe our channel and support us, and kindly enable the bell button so that you will get notification whenever we are uploading new videos. So now you are watching the 10th series of AIIMS NORCET series. So straight away, without losing time, we will move on to the questions. So the 10th NORCET series for you. So we will be moving into the first question in this series. So the first question is from the pediatrics, and the question is: children develop team spirit during which stage of development? So the question is regarding the team spirit development in children. So at what time it will be developed? So the options are: option number A, adolescent stage; option number B, pre-adolescent stage; option number C, toddler stage; and option number D, early adulthood stage. So the question is regarding the development of team spirit. So the answer for this question is option number B, that is pre-adolescent stage, not in the adolescent stage, because there you might have a confusion regarding that we will clear now. So pre-adolescence is the school age where students start learning group activities or developing the team spirit, and in short, the school age time is the formation of team spirit, and adolescent time is the team spirit changes. Okay, so the first group activities, then the team spirit, those things will be starting in the pre-adolescent stage, and in adolescent stage this team spirit will change. Okay, so beginning development will is happening in the pre-adolescent stage. Okay, so that's all regarding the first question. Now we can move on to the second question in the series. So the question is: which among the following is the most urgent complication in a patient with non-Hodgkin's lymphoma? So non-Hodgkin's lymphoma, which is the most urgent complication. Most urgent complication in the sense that we have to intervene very fast. Okay. So the options for you are: option number A, an elevated WBC, that means more than 50,000. Then option B, a uric acid of 5. Option number C, a mediastinal mass. And option number D, complaints of left flank pain. So think about non-Hodgkin's lymphoma and you can come to the answer very easily. So the answer for this question is option number C, that is mediastinal mass. So we know that the presence of a mediastinal mass should be ruled out with all new patients with non-Hodgkin's lymphoma. So as per the statistics, approximately 25% of patients with non-Hodgkin's lymphoma have a mediastinal mass, and they may present with a cough, wheezing and malaise. So this can rapidly progress to respiratory distress, tracheal compression and superior vena cava syndrome, which constitute a medical emergency. That means it is lethal. So this is a very urgent complication of non-Hodgkin's lymphoma that need to be intervened very fast. Okay, because patient can go into respiratory distress and other features. Okay, so that's all regarding the second question. Now we can move on to the third question in the series. This is from psychology, first year topic. So girls are very talkative, rich are cruel to poor. So this is a statement, and you have to find out these inaccurate generalizations and assumptions are examples of. So here I have given two statements, so you have to find out this is an example of what. Okay, so girls are very talkative, rich are cruel to people, like to poor, like these inaccurate generalizations and assumptions. So the options are option number A, recency effect, option number B, halo effect, option number C, stereotyping, option number D, perceptual defect. So what is the answer? So the answer for this question is option number C, that is stereotyping. Okay, so what is stereotyping and what are the other options, that we will have a small discussion now. So first of all, see stereotyping. So stereotyping means it is making positive or negative generalizations about a group or category of people, usually based on inaccurate assumptions and beliefs, and applying these generalizations to an individual member of the group. Okay, so like what I have given in the questions, like girls means they will be very talkative, like that statements, because that is not an accurate assumption, and these are just beliefs or inaccurate assumptions, and just these are applying to the generalized group. Okay, so like such a thing is known as the stereotyping. Okay, so I think you got the point. Now the other options we will see. So what is a recency effect? So the recency effect, it is a cognitive bias in which those items, ideas or arguments that came last are remembered more clearly than those that came first. Okay, so here the last argument or last idea or last item will be more clearly remembered. That effect is known as the recency effect. So the example is, if you are trying to memorize a list of items, the recency effect means you are more likely to recall the items from the list that you studied last. Okay, so that effect is known as the recency effect. I think that is clear for you. Now next option was the halo effect. So what is the halo effect? So halo effect is a form of cognitive bias, a heuristic, that means a mental shortcut that causes us to make snap judgments. Snap, that is the main thing, snap judgments. So in other words, the halo effect leads us to consider only one aspect of a person or a product in order to form a general opinion. So only one aspect of a particular person or a particular item or a particular product or a particular situation is taken into consideration, and we used to generalize that opinion. That is known as the halo effect. So for example, you might see a physically beautiful person and assume they are generous, smart or trustworthy. Okay, so this is known as the halo effect. So these all things can be seen in in all human beings in their regular life. Okay, so this is halo effect. Then last was the perceptual defect. So what is a perceptual defect? So it is an impaired ability to organize and interpret sensory experiences, causing difficulty in observing, recognizing and understanding people, situations, words, numbers, concepts, images, etc. So this is also known as a perceptual defect. So it is an as the name indicates, it is an impaired ability to organize and interpret the sensory experiences. Okay, so that is a perceptual defect. Okay, so that's all regarding the third question from psychology. I know that it is little confusing, but I think that question was informative for you. Now we will move on to the fourth question. So the question is, during starvation, for about how long do the body's carbohydrate stores last? So in simple words, I can tell, like when the glycogen storage will be depleted, when the glucose storage will be used during the starvation time. That is a question. So the options are option number A, 8 hours, option number B, 12 hours, option number C, 24 hours, and option number D, 72 hours. So the answer for this question is option number C, that is 24 hours. Okay, so we know that most glycogen is stored in the liver which has the greatest role in the maintenance of blood glucose during the first 24 hours of a fast. Okay, so during fasting, the first 24 hours, this glycogen which is stored in the liver will be used for maintaining the blood glucose level. So after fasting for around 24 hours, the glycogen stores are depleted, causing the body to utilize the energy stores from adipose tissue and protein stores. Okay, so first the glycogen storage will be used, and if it is exhausted, then the energy utilization will be happening from the adipose tissues and from the protein stores. Okay, so that will be happening only after 24 hours. So till 24 hours during fasting, the glucose requirement is met by the glycogen. Okay, so that was a question, and I think you got the point. Now we will move on to the fifth question. So an important question: deficiency of which trace element causes Keshan disease? Okay, so the Keshan disease is caused by the deficiency of which trace element? That is a question, and the options are: option number A, copper; option number B, zinc; option number C, iron; and option number D, selenium. So what is the answer? Deficiency of which trace element causes Keshan disease? So the answer for this question is very important. That is option number D, that is selenium. So we will see what is a Keshan disease and what is the role of selenium in that. So Keshan disease, otherwise known as the KD, it is a type of dilated cardiomyopathy which is closely related with a diet which is deficient in the mineral selenium. Okay, so this Keshan disease, the characteristics are: it is an endemic, highly lethal cardiomyopathy, and the clinical manifestations of this disease include primarily congestive heart failure, acute heart failure, and cardiac arrhythmias. Okay, so these are the peculiarities or the features of the Keshan disease, and this is caused because of when there is a deficient in the mineral selenium in our diet. Okay, so that is a Keshan disease. Okay, so other deficiencies you know very well, but just I mentioned regarding the signs of possible copper deficiency, which include anemia, low body temperature, bone fractures, osteoporosis, low white blood cell counts, irregular heartbeat, loss of pigment from the skin, then thyroid problems, etc. can happen with possible copper deficiency in our diet. I just told this because it was mentioned in the options. So another trace element what I have given was the zinc, and the zinc deficiency can result in skin changes mainly that look like eczema, and there may be cracks and glazed appearance on the skin, often found around the mouth, nappy area, and hands. And in addition to the skin problems, there will be having hair loss issues, lack of alertness, and a reduced sense of taste and smell with zinc deficiency. So copper deficiency we have explained, then zinc deficiency also we have explained, and regarding the Keshan disease we have explained very well. Okay, so now we will move on to the sixth question. So the question from the ICU related question. So the question is: which among the following is often the cause of respiratory alkalosis in mechanically ventilated patients? So in simply, what is the cause of alkalosis in mechanically ventilated patient? That is a question for you. So the options are: option number A, over sedation; option number B, over analgesia; option number C, hyperventilation; and option number D, all the above. So read the question carefully, see the options carefully, and find out the answer. So in this, the answer for this question is option number C, that is hyperventilation. Okay, hyperventilation is the main reason for the respiratory alkalosis in ventilator patients. Okay, so in mechanically ventilated patients, hyperventilation is often the cause of respiratory alkalosis. So respiratory alkalosis occurs when hyperventilation makes it hard for the lungs to get rid of excess carbon dioxide. Okay, so sometimes questions may ask like in which mode of ventilation you can get respiratory alkalosis more. So assist control mode of ventilation is the most prone for getting respiratory alkalosis, because patient can go to, because patient's effort also will be there. So there are chances like patient can go into hyperventilation and then to respiratory alkalosis. So to reduce this hyperventilation, we have to provide what? Inadequate sedation and pain control may contribute to the respiratory alkalosis in patients breathing over the set ventilator rate. Okay, so this is the reason. Okay, so what we have to do is we have to sedate the patient adequately and we have to manage the pain of the patient adequately. Okay, so the other options are cancelled because of this reason. Okay, so hyperventilation, respiratory alkalosis. Okay, so I think you got the point, and we can move on to the seventh question in our series. So another question, important question: patient receiving succinylcholine need to be monitored for which electrolyte? So which electrolyte to be monitored if the patient is receiving succinylcholine? So the options are option number A, sodium; option number B, magnesium; option number C, calcium; and option number D, potassium. So which one need to be monitored for while giving succinylcholine for a patient? So the answer is option number D, that is potassium. Okay, so we will see why potassium. So succinylcholine, what is the action? It is a depolarizing muscle relaxant, okay, that has been used for rapid sequence induction and for the procedures which requires only a brief duration of muscle relaxation. Okay, so succinylcholine, this is the action, it is a muscle relaxant. So what will happen is the systemic succinylcholine can depolarize all the upregulated acetylcholine receptors, leading to massive efflux of intracellular potassium into the circulation, resulting in hyperkalemia. So because of this upregulated acetylcholine receptors, there will be massive influx or efflux of intracellular potassium into the circulation. Okay, the potassium will go into the circulation, which can result in the hyperkalemia and related complications. So potassium need to be monitored for patients receiving succinylcholine. Okay, so that's all regarding the seventh question. Now we will see the eighth question in this series. So another very important question: osmotic demyelination syndrome is associated with which among the following fluids? Okay, so in clinical settings we will be administering fluids for the patient. So for which fluid administration we should be more careful? So that is another way this question can be asked. So here particularly I asked osmotic demyelination syndrome is associated with which fluid? So the first one is normal saline, second one is lactated ringer, option number C is 3% saline, and option number D is dextrosaline. So which can cause osmotic demyelination syndrome? So the answer is option number C, that is 3% saline. So for hyponatremia correction, we used to give 3% saline, and if you are rushing this fluid, then there are chances for the osmotic rehydration syndrome. So overly rapid correction of chronic hyponatremia with 3% saline results in brain dehydration, rendering it susceptible to the osmotic demyelination syndrome. Osmotic demyelination syndrome. So central pontine myelinolysis, this is another name for the osmotic demyelination syndrome. Okay, central pontine myelinolysis. So it is a neurological disorder that most frequently occurs after too rapid medical correction of sodium deficiency, that is hyponatremia. So keep these points in mind. 3% saline should not administer rapidly, can result in osmotic demyelination syndrome. Okay, so that's all regarding that point. Question. We will have the ninth question discussion now. So the question is: the most significant health status indicator of a community is. So another confusing question: the most significant health status indicator. So that is the question. Options are option number 1 in A, infant mortality, option number B, maternal mortality, option number C, neonatal mortality, and option number D, life expectancy. So which is the most significant health status indicator? significant. That is the key point. So the answer for this question is option number D, life expectancy. So we will see what is the life expectancy. So life expectancy is an important health status indicator based on the average number of years a person at a given age may be expected to live in the given current mortality rates. Okay, so life expectancy can be measured at birth, that means at age 0, which is the most commonly used for national and international comparisons. Okay, so this is the most significant, okay, health status indicator both nationally and internationally. Okay, life expectancy. So what is the you will have a confusion like regarding the infant mortality rate. So it is the most widely accepted as one of the most sensitive indicator. Okay, so this is the most sensitive indicator of the health status of a country or a region or a district or a state, whatever it is. Okay, so this is the most sensitive. The question was regarding the most significant. Okay, so don't be confused. Okay, so I think that was really useful for you, this question. Now we can see the 10th question. So this is from the administration, nursing administration, and the question is the evaluation of nursing care by the observation during the delivery of care is called as dash. So during the delivery of care, that is the important key term in this question. So the options for you are option number A, nursing management audit. So option number B, a retrospective audit. Option number C, concurrent audit. And option number D, final audit. So I need the most specific answer for this question. So what is the answer? During the delivery of care, which audit? So the answer is option number C, that is a concurrent audit. So we will have the difference between these audits. So the concurrent review or the concurrent auditing refers to the evaluations conducted on behalf of patients who are still undergoing care. That means during the care. And it includes assessing the patient at the bedside in relation to predetermined criteria. Some criteria will be, some checklist will be there. So based on that, the assessment will be done at the bedside, then interviewing the staff which is responsible for the care of that particular patient, and reviewing the patient's records and care plans. Okay, so this is the concurrent review or the concurrent auditing. Then what is a retrospective audit? So as the name indicates, retrospective. So it is a method for evaluating the quality of the nursing care by examining the nursing care as it is reflected in the patient care records for discharged patients. Okay, so in back way we are checking, okay, auditing, that is known as the retrospective audit. Then we can see the 11th question in our series. So another important question, what is the scientific name for Vicryl suture? So the question is, what is the scientific name for Vicryl suture? So the options for you are option number A, polyglatin 910. Option number B, polypropylene. Option number C, polyamide 6. And option number D, polyglycaprone 25. So what is the scientific name for Vicryl sutures? So what all options what I have given here are the chemical name for the other sutures. So your task is to identify the Vicryl suture scientific name. So the answer is option number A, that is a polyglatin 910. So you know that Vicryl or the polyglatin 910 is an absorbable synthetic, usually braided suture manufactured by the Ethicon, a subsidiary of Johnson & Johnson. Okay, so Vicryl is an absorbable synthetic, usually braided suture. Okay, polyglatin 910. So we'll see the other options also. So in the other options, the next option was polypropylene. So it is a non-absorbable synthetic monofilament surgical suture. So this suture is not subjected to degradation or loss of strength caused by the enzymatic action of the tissues. So this is very, very important. So because of that, this has steadily gained popularity for use in vascular and cardiac surgical procedures because of its long-term tensile strength and minimal tissue trauma. Okay, so that is the polypropylene sutures. Okay, these are non-absorbable hard sutures. Okay, polypropylene. So that was the second option. Then the third option was regarding the monofilament polyamide sutures. Okay, so this is a non-absorbable sterile synthetic surgical suture commonly known as the polyamide or nylon sutures. Okay, so the nylon suture is the chemical name for the nylon suture is monofilament polyamide suture. Okay, this is also a non-absorbable suture. Then the next option was regarding the monocryl suture or the polyglycaprone 25. So this is a monofilament synthetic absorbable surgical suture prepared from a copolymer of glycolide and E-caprolactone. Okay, so these are just additional information for you. So through this question you have learned about the four sutures and its chemical names. Okay, so this can be asked in the exams. So we will move on to the 12th question in the series. So the question is the variable from the this is from the nursing research. So the variable that is being measured or tested in an experiment is known as. So this is a basic research question. Options are option number A, the dependent variable. Option number B, the non-dependent variable. Option number C, the experimental variable, and option number D, the manipulated variable. So what is the answer? So the answer is option number A, the dependent variable. So the other options are non-dependent variables, the other names for the non-dependent variables. So we'll have a small discussion regarding this question. So the dependent variable is the variable that is being measured or tested in an experiment. Okay, that means the dependent variables are studied under the supposition or demand that they depend. Okay, so as the name indicates, it is very easy to understand. Then independent variable or the manipulated variable, it means these are not seen as depending on any other variable in the scope of the experiment in question. So the experimental variable is also an independent variable. That means same. It is manipulated by the researcher to determine its relationship to or influence upon some outcome or dependent variable. So these are the independent variables. Okay, so that's all regarding that question from nursing research. Now we will see the 13th question, another important question. So Beck's triad is associated with dash. Beck's triad is associated with dash. So A, rheumatic fever. Option number B, cardiac tamponade. Option number C, COPD. And option number D, ESRD. So Beck's triad is associated with which among the following? So the answer for this question is option number B, that is cardiac tamponade. Cardiac tamponade. So we will see what is a Beck's triad and what all things are coming under this triad. So Beck's triad, it is a collection of 3 medical signs which are associated with acute cardiac tamponade, a medical emergency when excess fluid accumulates in the pericardial sac around the heart and impairs its ability to pump the blood. So here I have explained about the cardiac tamponade. So in cardiac tamponade we can see 3 medical signs which includes low arterial blood pressure, then distended neck veins and distant muffled heart sound. Okay, so these are the 3 medical signs which can be seen in cardiac tamponade, which is termed as the Beck's triad. Okay, low arterial blood pressure, distended neck veins and distant muffled heart sound. Okay, so this is Beck's triad. So that's all regarding that question. I think we can move on to the second last question in our series. So here your task is to identify an organization, and this is a picture based question and this is the picture for you. So you have to identify the organization. Okay, so what is this organization? So the options for you are option number A, UNICEF, option number B, NACO, option number C, WHO, and option number D, CDC. So this is a symbol, this is the emblem for an organization. So which is that organization? So this is a symbol for which one? This is for the WHO. Okay, WHO's symbol. So what is this symbol? So WHO's emblem was chosen by the first World Health Assembly in 1948. So the emblem consists of the United Nations symbol, which is surrounded by a staff with a snake coiling around it. Okay, so this is the medical profession symbol. Okay, so that medical profession symbol, United Nations symbol, all together made the WHO symbol. Okay, so this is the WHO symbol. Then the other options we will see. So this is the UNICEF, United Nations International Child Fund. Okay, so a child drinking milk, it becomes the symbol of UNICEF. Okay, child drinking milk, and their theme is to like all babies on the planet should be surrounded by love and live in a safe world. Okay, so this is UNICEF symbol. Then next comes the CDC, that's the Center for Disease Control and Prevention. So it is a national public health agency of the United States. So this is their symbol. And final, it was the NACO. So NACO means National AIDS Control Organization. So it is India's voice against AIDS, and it is under the Ministry of Health and Family Welfare, Government of India. Okay, so this means it provides a leadership to HIV or AIDS control program in India. So this is the NACO symbol. Okay, so we have seen regarding the four organizations and their symbols and its peculiarities. So with that, we will move on to the final question in the series, that is the 15th question. Siderosis affects which organ? I think it's a simple question for you. Siderosis affects which organ? So options are option number A, kidney, option number B, liver, option number C, brain, and option number D, lung. So siderosis affects where? So siderosis, this name we have heard in the occupational diseases. Okay, so answer is option number D, that is lung. Okay, so siderosis, this is a deposition of excess iron in the body tissues. So iron is the key point. So when used without qualification, it usually refers to an environmental disease of the lung, also more specifically known as the pulmonary siderosis or Welder's disease. Okay, so this is an additional information for you. Pulmonary siderosis, otherwise known as the Welder's disease, so which is a form of pneumoconiosis. So what is pneumoconiosis? Pneumoconiosis is the general term for a class of interstitial lung diseases where lung inhalation of the dust has caused the interstitial fibrosis. Okay, so that is pneumoconiosis. So pneumoconiosis, one form of pneumoconiosis is the siderosis. So iron is the key point. Okay, so with that, we are coming to the end of this session, this series, the 10th session with 15 questions, and I believe that these 15 questions helped you to prepare better for the AIIMS NORCET examination. So like that, you can expect the next series of questions very shortly. So requesting everyone to keep in touch with us, to watch the videos till the end, and share about this platform to your nursing friends and make use of it. Okay, so once again, thank you for watching the video. So see you soon in the next video very shortly. Till that time, bye. Thank you.